while I'm pulling this up, so your clip was really interesting. You had picked the one with the prisoner that they bring in, and let me
Hmm.
see if I can actually find it. Maybe it's in the wrong folder.
Supposed to go to Westbridge, but got diverted to you.
Yeah, you and everybody else.
Princess, I need you to pivot to Central 9. Got it.
Gus Varney, 54, victim of assault with diffuse blunt trauma. He's got bruising to the face, the right chest, 10-centimeter laceration to the left arm. BP's 136/84, pulse 102, good sats, 95 on room air.
How you feeling there, Mr. Varney?
Fucking hurts.
Where?
Everywhere.
I am Dr. Robbie. This is Dr. Alashimi.
We'll get you something for the pain.
I've got progressing cellulitis.
Go, I'm good.
Thank you.
Gus, do you know who hurt you?
One of the fine upstanding citizens of cell block 6.
It's a deep whack through the muscle fascia. Can we get the cuffs off once he settles?
Not a chance. Orange jumpsuit, he's cuffed for a reason.
Let's go. Okay, everyone on my count. 1, 2.
Hold on. Go.
1, 2, 3. Al, E fast. Whitaker, primary assessment.
On it.
Oh, weird bruise. Did he fall on something?
Footprint. Get stomped.
Jesus. Is that necessary?
Afraid so.
Airways patent.
Good lung sliding on the left. Ah! Sorry. Good on the right, too.
How are the lungs?
Good breath sounds. No crepitus.
No effusion.
Pulse ox 97, BP 118/78, heart rate 112.
Tachycardic from the pain.
Start with 4 of morphine, repeat PRN.
On it.
Okay. Swollen mandible. Open your mouth for me, Gus. Little wider.
Can't.
Whitaker, you know the tongue blade exam?
Yeah.
It's a great test for a mandible fracture.
Gus, bite down hard on this for me. Sorry, Gus. Positive test.
No free fluid in the belly.
Any idea how long this will take?
Too soon to tell. Whitaker, your assessment?
Fractured left mandible, multiple rib fractures, complex forearm lack.
Okay, log roll to the left and pan scan.
Where were you when Mr. Varney got assaulted?
I just move him. I don't get to know him. CT's ready for us.
Psych.
Okay, tell us why you picked this clip.
Yeah, man. I think this exact situation brings up a lot of emotions and a lot of personal stories that I had taking care of incarcerated individuals, or even just individuals who comes in from, they come in unhoused or with police custody, ICE nowadays, as you know. It just brings up the issue of bias and how that presence of someone, like an officer or someone from prison can actually bias the care they get. And I'll be honest with you, this is easy one, right? This is a trauma case, and trauma for us, as you know, is very standardized. It's very protocolized. So everybody comes in, get the same assessment, primary assessment, secondary assessment, pan scans. But think of this patient as someone with abdominal pain. How would you handle that person in the presence of a police officer or a security person or ICE? I think that definitely changes the way some people would think. And I'd rather say, I like to say that definitely these patients can be stigmatized, dehumanized, in so many ways. And definitely a learning opportunity for our medical students and residents to be able to acknowledge these biases and address them, right, while providing, a more equitable care for these patient population.
Yeah, 100%. It's how I think about it is whenever like a patient, whoever it is, comes through like the doors of the ER or hospital, like it doesn't matter who they are, right? We treat everyone equally, but in the scene you see that being obstructed in a way, right? Like the handcuffs or, moving him from the stretcher to the bed, like, oh, we got to delay it because you didn't take the handcuffs off in the first place. So it doesn't mesh well with kind of how we're trained to treat people, which is everyone's a human and we're there to, serve them. And then when you have these like obstructions in the way, sometimes it can feel like, obviously something's not matching here. And then, like you said, a lot of times we will have, and I'm not, trashing law enforcement. They have a very important job. They're partners with us in most circumstances. But a lot of times, we'll get a patient and be like, oh, they're just here for a med clear and we'll be on our way. And it's so easy sometimes to be like, okay, med clear, this person looks fine, but did each of us really do a true full physical exam? Did you really get the past medical history and what meds are on and everything? And we should, but like you said, if you get trained in an environment or maybe you kind of are on a really busy day, sometimes we can all fall into that trap. So whether you're us or a med student or a resident or someone thinking of going into medicine, how you treat a patient doesn't change because they're coming from prison or they're coming off the street or wherever they may be coming from.
I mean, you still must. So that's the same thing I was thinking. Like, someone patient comes in, medical clearance, you have to make sure you do a full assessment. Because even in this scene, he was like, "How long is it going to take?" Like, you are conscious of the cop's time. It was like, you have to make sure you do what's right medically for the patient. I know you want to get out of here. I worked in a small town one time. Like, they would bring patients in, and like, this officer's off the street for that amount of time. They're trying to get out of there as quick as they can. But I understand that. But we have to still make sure you brought him here for a reason. If I don't do my job, then it's on me. It's not on you. You're gonna be like, "Oh, well, the doctor discharged him." So you got to make sure you treat the patient accordingly, what they're there for.
Yeah, and the level of and we also have to think, whether you are unhoused or coming from a jail, you don't have the same level of access to, like, we give everyone return precautions, right? Like, hey, if the pain gets worse, come back. Well, that person who's in that jail, if their pain gets worse and they report it, they may be kind of labeled as like, oh, you're just trying to get out of jail again and you're just trying to look for another field trip. And so for them, from my perspective, we have to be like way more thorough because like they may not be able to act on the return precautions like the healthy 32-year-old that you sent home with abdominal pain maybe. And
they may not get meds. They may go back to prison and they may not, need some pain meds every 6 hours. They may not get them every 6 hours. They may not have access to pain meds and things like that as well.